Welcome to the deep dive. Today, we're zeroing in on something vital but maybe often overlooked, the median nerve.
That's right.
We're using a great source, a short note for orthopedics residents. Basically a shortcut to getting you really clued in on this complex nerve. Our mission, trace its path, figure out what it does, and, pinpoint where things can go wrong. Okay, let's unpack this.
What's fascinating here, I think, is how knowing the anatomy, the exact route of this one nerve, really sheds light on so many common issues, problems people feel every day in their hand and arm. It's a direct link.
Absolutely. So let's start right at the beginning. Where does it come from? It's not just poof.
Right. It's formed from the brachial plexus. That's that big network of nerves up by the shoulder and neck.
Okay.
Specifically, it gets contributions from the lateral cord, that's nerve roots C5, C6, C7, and the medial cord C8 and T1.
So like two streams merging.
Exactly, yeah. Two bundles of fibers joining up to make this one pretty major nerve. That origin explains why it affects such a wide area, really.
Okay, so it forms up there.
Yep.
Then what? It starts heading down the arm.
Yep. Travels down the upper arm, usually running right alongside the brachial artery, the main blood vessel there. And interestingly, it doesn't really give off any major branches in this upper section. It's quite passive.
Holding its cards close to its chest, maybe?
You could say that. Then, as it gets near the elbow, it passes through the cubital fossa. That's the crease on the inside of your elbow.
Right.
It lies just medial or towards the inside of the biceps tendon there.
And that leads into the forearm. Does it get trickier there?
It definitely gets more complex and, potentially more vulnerable. As it enters the forearm, it has to pass between the two heads of the pronator teres muscle.
Ah, okay. That's a muscle that turns your palm down, right?
Exactly. And that spot passing between the muscle heads, it's a naturally tight passage.
So a potential pinch point.
Precisely. If that muscle gets tight or swollen, bang, can squeeze the nerve. That leads to trouble.
Makes sense.
Then it continues down, traveling between two layers of finger-bending muscles, the FDS and FDP.
Okay.
And somewhere along this path, it gives off a really important branch, the anterior interosseous nerve, the AIN.
We'll probably come back to that one.
We will. It finally emerges more superficially near the wrist, getting ready to enter the hand.
Right, through the famous carpal tunnel, the main event for many people.
You could say that. It passes deep to that tough band of tissue, the flexor retinaculum, which forms the roof of the tunnel.
And it's pretty close to the surface there.
Yeah, relatively. Just under the palmaris longus tendon, if you happen to have one. Not everyone does.
Huh. And once it's in the hand, what's its job?
Okay, this is where it really shines. It gives off a crucial little branch, the recurrent branch, which goes straight to the thenar muscles.
Those are the thumb muscles.
The muscles at the base of your thumb, yeah. Absolutely vital for gripping, pinching, opposing your thumb to your fingers. Really key hand function.
And sensation too, right?
Oh, definitely. It provides sensation through its digital branches to the palm side of your thumb, your index finger, your middle finger, and half of your ring finger.
Wow, that's a lot of important real estate.
It really is. Think about trying to button a shirt or feel textures without that sensation.
Yeah, no kidding. So tracing that path really highlights the vulnerable spots. Let's connect that anatomy to the clinic, the so what moments.
Exactly. If we look at the bigger picture.
Like that spot you mentioned back at the elbow, passing through the pronator teres muscle.
Right. If the nerve gets compressed there, that can cause what's called pronator syndrome.
And what does that feel like? Is it like carpal tunnel?
Sort of, but the pain is often more in the forearm, like a deep ache. And you can get tingling in those same median nerve, fingers, thumb, index, middle, half ring.
Okay. And what about that AIN branch you mentioned, the anterior interosseous nerve?
Ah, yes, AIN syndrome. Now, what's really distinctive here is that it's almost always a purely motor problem. No numbness, no tingling usually.
Just weakness.
Just weakness. Specifically in the muscle that bends the tip of your thumb, FPL, the one that bends the tip of your index finger, FDP to index, and one of the forearm rotators, pronator quadratus.
So how would someone notice that?
The classic sign is they can't make a proper OK sign. The tips of their thumb and index finger won't bend properly to make that nice round circle. It looks more like a pinch.
Fascinating.
Yeah.
And then the big one, carpal tunnel syndrome. Compression at the wrist.
Yeah, the celebrity nerve issue, right?
Yeah.
This is the one most people have heard of. The nerve gets squeezed inside that narrow tunnel at the wrist.
And this one is sensory and motor.
Yes. You get that classic numbness or tingling, often worse at night, in the thumb, index, middle, and half the ring finger. And over time, if it's bad, you can get weakness and even visible wasting of those thenar thumb muscles. Weak grip.
It's amazing how specific the symptoms are depending on where the squeeze happens.
It truly is. A few centimeters difference along the nerve's path can totally change the clinical picture. It's like a diagnostic map built right into our anatomy.
So what does this all mean? I guess this deep dive really shows how these intricate systems inside us have such a huge impact.
Yeah.
Basic movement, essential feeling.
Right. And understanding these pathways gives you real insight into both how resilient our bodies are, but also how, well, vulnerable they can be in specific spots.
It's a delicate setup.
It really is. And it raises an important question, doesn't it? How does this incredibly complex, vital structure function so perfectly most of the time, yet be susceptible to problems in these narrow passages?
Yeah.
It makes you appreciate the constant silent work happening inside us that we often only notice when something goes slightly wrong.
A great point to ponder. Well, that's our time for this deep dive. Until next time, keep exploring.